Happy New Year to all supporters of the NHS and of course all the hard-working staff that work right across that service. This is a film made by Keep Our NHS Public for Dorset, and it's an update on all the hard work done by all the Dorset campaigning groups that have been working to try and save Poole A&E and save the maternity unit and indeed safeguard the NHS for the whole of Dorset. You'll remember just before Christmas that we had a lot of activities, a lot of activism, a letter writing campaign, and all of that pressure forced the council here in Poole to hold a meeting and to have a vote on whether to refer the closure of the A&E and the maternity services to the Secretary of State.
Well, we're hoping that they will vote the right way. Clearly it's not in the best interests of the people of Poole to close their A&E and maternity. And under the 2012 Health and Social Care Act, these councillors have got a duty to refer any plans that are not in the interests of Poole residents, and quite clearly these plans are not in Poole residents' interest.
I think the plan to move the Poole Accident and Emergency and the maternity services, and I think there are other things involved as well, all to Bournemouth Hospital is so dangerous for lots and lots of people living in the area. Anybody who lives to the west of Poole, for instance, in the Wareham, Swanage, Purbeck area, the additional travel time is going to cost lives. There's just no two ways about it.
Poole Council voted in summer 2017 to try and save their A&E and maternity. Since when they've done precisely nothing to achieve that goal, they would have needed to have referred it as we're asking them to do now.
Well, I'm really pleased to say that that meeting did go ahead, and that the outcome of that meeting was that Poole Council have agreed to support Dorset County Council's letter going straight to Matt Hancock. Now, we would have preferred it if Poole Council had written their own letter supporting their own hospital, but nevertheless, this was a super outcome for all the hard work done by the Dorset campaigners, and it just goes to show that by putting pressure, by taking action, you can make a difference. Although these plans are made out to be for the benefits of the Poole and Bournemouth and wider conurbation, actually they're part of a plan for the whole of England. And that's the downgrading, the rationing of our NHS because of that 22 billion shortage of funding as part of the wider austerity campaign. So we know that the downgrading of our A&E here in Poole and the closure of our maternity units is part of a wider plan where there are 24 A&Es across the country earmarked for closure. That's a whole 15%. And that information was put out back in February of 2017. Now, this question was asked back in that meeting, but we really didn't get a satisfactory response.
These plans in Dorset are not a bespoke plan for Dorset because similar closures, downgrades are happening.
Thank you. It was a question. Thank you.
The 5-hour meeting was dominated by the unelectable, unaccountable members of the CCG and others with a real vested interest in seeing these plans go ahead. Ordinary members of the public who had turned up to have their voices heard were cut short, basically.
I think my concern is just a little bit like Mr. Brown's here, insofar as, sorry, please don't cut me off, because I'm on that. No, I am, because otherwise it might sound like I haven't listened to what's been said this evening, and I have.
People of the public had to submit questions 2 days in advance of the meeting, and these questions were limited to 100 words. In the meantime, the CCG had put out a new report, which then dominated the meeting, and members of the public hadn't been able to see the report, weren't properly able to comment on the report, and instead had to stick to the exact wordings of their original questions, which had now been made out of date.
Now, as you know, the CCG have just updated their report, released to the media 2 days ago. So we've had no opportunity to change the format of our questions. Therefore, it makes the questions totally irrelevant.
And this is just a continuation of the complete bias that we see running through this so-called consultation period. As we know, the original consultation document was extremely wordy, extremely lengthy, misleading, biased. The same people who wrote that questionnaire were the people who analysed the responses. That in itself puts serious questions on the findings from that report, making it, you could argue, actually invalid. Whereas a good petition that had a whole 37,000 signatories against these proposals, against the downgrading and the closure of our maternity unit, were ignored. So we really don't think that throughout this whole process people have been able to voice their concerns in a fair and open way. Keep Our NHS Public Dorset has tried to keep you up to date and informed about the way in which our Poole councillors have voted in terms of healthcare changes. As we approach this new year, there is a lot of political uncertainty, nationally with Brexit, but locally we have a new unitary authority as our council. Councillors from Poole, Bournemouth and Christchurch will sit together. Poole councillors are looking for reselection, and if you really want to defend our NHS, you need to think carefully about who you are going to vote for. Which of those councillors are worthy of getting your vote? Okay, so what now for 2019 for Dorset Health campaigners? We think we've got a really busy year coming up. So firstly, there's the letter that's going to be written by Dorset County Council asking the Secretary of State to review these plans. We know that Poole Council will be writing a letter to support that referral. Why don't you write to your local councillor and ask to see a copy of that letter? We, of course, will be doing that. But the more people who do that, the more we get that message to the council that there are people here who want to save our NHS. We also have the appeal for the judicial review going ahead, and we really congratulate Defend Dorset for all the really hard work that they've done towards that. All the money's now been raised and that appeal will be coming up. And some exciting news for Friday, the 8th of February. We have GP and NHS activist Dr. Bob Gill. He's going to be coming down to Poole to talk about his concerns about what's happening in the wider spectrum of our NHS. And he is crowdfunding for his film, so we'll be helping him to do that.